This is Session 5, Colorectal Cancer. In today's session, we will learn about colorectal cancer, the anatomy of the colon, and the burden of colorectal cancer. We will also discuss risk factors and symptoms for colorectal cancer, as well as types of screening for colorectal cancer. Lastly, we will discuss questions you should ask your doctor and treatment options for colorectal cancer. Cancer is caused by cells that are not normal and grow out of control in the body. Colorectal cancer, abbreviated CRC in Project HEAL, is a cancer of the colon and rectum. Colorectal cancer is believed to grow slowly from polyps. Polyps are tiny growths in the inner wall of the colon and rectum. These precancerous growths can keep growing and form a cancerous tumor. Question: my friend told me that she had a polyp removed that helped to prevent colorectal cancer. Can removing a polyp prevent cancer? Answer: yes. Taking out the polyp early may prevent the polyp from turning into cancer. The exact cause of colorectal cancer is unknown. If caught early, it can be treated and cured. Colorectal cancer occurs almost the same amount in both men and women. The colon is part of the digestive system. Parts of the digestive system include the esophagus, stomach, and small and large intestines. The digestive system removes and processes nutrients such as vitamins, minerals, carbohydrates, and fats from foods. The digestive system also helps the body remove waste materials. The first 6 feet of the large intestine is the colon, and the last 6 inches is the rectum and the anal canal. This image shows the anatomy of the colon. Colorectal cancer is the third most common cancer among men and women in the United States. It is also the second leading cause of cancer-related death in the United States. There were about 135,000 new cases of colorectal cancer in 2016. In 2011, there were 2,352 new cases of colorectal cancer in Maryland. In 2016, there were over 49,000 deaths in the U.S. due to colorectal cancer. 1 in 21 men and 1 in 23 women will develop colorectal cancer in their lifetime. There are different risk factors that raise your risk for colorectal cancer. One risk factor is age. Colorectal cancer is most common in men and women over 45. Also, having a personal history or family history of colorectal cancer raises your risk for getting the disease. Question: what kind of personal or family history should I be aware of? Answer: a personal history or family history of colorectal cancer includes having a prior cancer diagnosis, a history of polyps in the colon, or a history of ulcerative colitis. Having a history of inflammatory bowel disease can also raise your risk. Diets that are made up of foods low in fiber and high in fat and calories also raise your risk for colorectal cancer. Physical inactivity is another risk factor for colorectal cancer. Tobacco use is also a risk factor. Lastly, not getting screened for colorectal cancer at the recommended age is a risk factor for colorectal cancer, especially because some types of screening can prevent colorectal cancer. Early colorectal cancer usually has no symptoms. Signs usually occur only when the cancer is more advanced. Even without symptoms, you should not delay or ignore colorectal cancer testing. If you have any of the following symptoms, tell your doctor. Symptoms include a change in bowel habits, blood in the stool, diarrhea, constipation, and feelings of bowel not emptying completely. General abdominal discomfort like gas pain, bloating, or cramps, unexpected weight loss, constant tiredness, and vomiting are potential symptoms of colorectal cancer. Question: Does having these symptoms mean that I have cancer? Answer: no. Having these symptoms does not necessarily mean that you have cancer, but you need to talk to your doctor to be sure. You can lower your risk of getting colorectal cancer by following the testing guidelines set by the American Cancer Society. Testing can find precancerous polyps. Taking out these polyps before they turn into cancer can prevent most colorectal cancers. Testing can also help find colorectal cancer early, when the chances for successful treatment are greatest. There are many types of screening tests that your doctor can do to detect polyps, cancer, and anything else that may not be normal. The 4 types of screening tests we will cover are fecal occult blood test, sigmoidoscopy, colonoscopy, and a double contrast barium enema. Question: when should I begin colorectal cancer screening? Answer: the American Cancer Society recommends both men and women follow a testing schedule starting at age 45. If you are at increased or high risk for colorectal cancer, the colonoscopy should begin before age 45. Fecal occult blood test checks for hidden blood in the stool. This test may be done at home or in your doctor's office. You will get a test kit from your doctor or your healthcare provider. At home, you place a small amount of stool sample from 3 bowel movements onto the test cards. You return the test cards to your physician or your healthcare provider to be tested for hidden blood. This test should be done every year for normal risk patients. No sedation or bowel preparation is needed. The flexible sigmoidoscopy allows the doctor to see the lining of your rectum and the lower part of your colon, or sigmoid, by using a thin, flexible, lighted tube called a sigmoidoscope. The test should be done every 5 years in your physician or healthcare provider's office for normal risk patients. No sedation is needed, but bowel preparation is needed. Your doctor may ask you to follow a special diet before the exam. This test is similar to the flexible sigmoidoscopy, except the doctors use a longer, thin, flexible lighted tube called a colonoscope. The tube is linked to a video camera and display. It is inserted into the rectum and entire colon to find and/or remove polyps and some cancers. Polyps can be removed using a wire loop that is inserted through the tube. Pieces of the polyp, or biopsy, can be sent to a lab to see if the pieces are cancerous. This test should be done every 10 years for normal risk patients. It is also used as a follow-up test if anything not normal is found during one of the other screening tests. Full bowel preparation and some sedation are needed. Question: is there anything I should know about bowel preparation and sedation? Answer: yes. Because of the bowel preparation, you may need to take the day off of work the day before the test. Also, because of sedation during the test, you will need someone to drive you home and may need to take the rest of the day off. This test allows the doctor to see an X-ray of your rectum and entire colon. You are first given an enema with a liquid called barium that flows from a tube into the colon. This is followed by an air enema. The barium and air create an outline of your colon to make it easier for the doctor to see polyps or anything else not normal. This test should be done every 5 years for normal risk patients. No sedation is needed, but full bowel preparation is needed. African Americans are impacted by colorectal cancer to a greater extent than most other groups. African Americans have higher colorectal cancer incidence and death rates than many other racial or ethnic groups. Many do not realize they are at risk at all. African Americans often do not go to the doctor because they do not feel symptoms. However, colorectal cancer symptoms tend to appear only in the later stages of the disease when the chances for survival are lower. So it's important to be tested even if you feel fine. Economic and cultural barriers sometimes play a role in lower rates of screening among African Americans. Things like medical costs and insurance issues, personal health priorities, for example, worrying more about one's family's health than one's own health, and fear or mistrust of doctors all lead to illnesses not being detected at an early stage when they're easier to treat. Here are some colorectal cancer screening facts. Colorectal cancer screening prevents death and late-stage diagnosis. All persons age 45 and older should be screened. Lastly, high-risk individuals may need to be screened at an earlier age. No matter what your background, start by calling your doctor and visiting your doctor. Having an honest talk about your cancer risk and what tests you need and when is a great first step to staying healthy. Learning more about the disease before your doctor's appointment can help you begin that talk. You can find more information on colorectal cancer risk and testing on the American Cancer Society's website at www.cancer.org or by calling 1-800-ACS-2345. That number is 1-800-227-2345. It is a good idea to write down questions to ask the doctor. Here is a list to get you started. Some example questions are, what is colorectal cancer? At what age do I start getting screened? And what is the screening test you recommend? Why? Some more questions to ask include, can I go back to work or drive after the test? And are there any risks to doing this test? Now we will cover common colorectal cancer myths. The first myth is that colon and rectal cancers are rare forms of cancer. However, they're quite common. In the United States, colorectal cancer is the third most common cancer in men and women, and it is the second leading cause of cancer-related death. Another common myth is if the polyps in the colon are not swollen and painful, they're not dangerous or cancerous. Question: I heard that polyps can be left alone if I do not feel any pain. Do all polyps need to be removed? Answer: yes, all polyps found need to be removed or sampled since they might lead to cancer in the future if not removed. Most of these polyps do not produce pain. Another myth is screening is only needed if you have symptoms. Many colorectal cancers have little or no symptoms. Without screening, you will not know if what you are feeling is from cancer until the cancer has grown. For example, you could have blood in your stool from a bleeding polyp that cannot be seen by the naked eye. Being able to find and remove polyps before they become cancerous is the purpose of screening. Many people also believe that once colorectal cancer is found, it is too late, but it's important to remember that early detection saves lives. No matter the stage of cancer when it is found, your chances of living a longer life are increased by acting on what you now know. Once the cancer is found, it can be removed and the process of healing begins. Question: I also heard that there is nothing I can do about getting colorectal cancer. Is that true? Answer: having risk factors for colorectal cancer does not mean that you will get it for sure. Colorectal cancer can be prevented. Screening tests can be done to find polyps that can turn into cancer. Taking out these polyps can prevent cancer from occurring. Many believe that eating herbs or proper diets
can prevent or cure colorectal cancer. Eating a proper diet can lower your risk of getting colorectal cancer or aid in the healing process if colorectal cancer is found. However, there's no evidence that eating a proper diet nor eating herbs will either prevent or cure colorectal cancer.
One other myth is that using laxatives and having regular bowel movements will prevent colorectal cancer. Because the exact cause of colorectal cancer is unknown, laxatives and regular bowel movements have not been found to prevent colorectal cancer. Question: if that is not true, does getting a colon cleanse prevent or cure colorectal cancer? Answer: colon cleansing is used to empty the colon of waste that has not been digested. There is no evidence that colon cleansing can lower the risk of colorectal cancer. Colon cleansing is not a cure for colorectal cancer. Another common myth that many people believe is that tests used to see if you have colorectal cancer will kill you. Colorectal cancer screening saves lives. Screening can find precancerous polyps, which are abnormal growths in the colon or rectum. These precancerous polyps can be removed before they turn into cancer. If everyone age 45 years or older were screened regularly, as many as 50% of the deaths from colorectal cancer could be prevented. The last myth we will cover is that screening tests for colorectal cancer are painful. There are several tests used to screen for colorectal cancer. You and your doctor will decide which test is right for you. Some people do have a feeling of discomfort when preparing for or taking part in the testing, but there is usually no pain associated with screening.
3 main types of treatment for colorectal cancer are surgery, radiation therapy, and chemotherapy. Depending on the stage of cancer, 2 or more types of treatment may be used at the same time or one after the other. Surgery is the main treatment for colorectal cancer. Usually, the cancer and a length of normal colon on either side of the cancer, as well as nearby lymph nodes, are removed. The 2 ends of the colon are then sewn back together. For colorectal cancer, a colostomy, or an opening in the abdomen for getting rid of bodily waste, is usually not needed, although sometimes a temporary colostomy may be done. Radiation therapy is treatment with high energy rays, such as X-rays, to kill or shrink cancer cells. The radiation may come from outside the body, which is external radiation, or radioactive materials placed directly in the tumor, known as internal or implant radiation. The main use for radiation therapy in people with colorectal cancer is when cancer has attached to an internal organ or the lining of the abdomen. If this happens, the doctor cannot be sure that all the cancer has been removed, and radiation therapy is used to kill cancer cells left behind after surgery. Radiation is rarely used to treat metastatic colon cancer. Chemotherapy is the use of anti-cancer drugs injected into a vein or given by mouth. These drugs enter the bloodstream and spread through the entire body. This makes the treatment useful for cancers that have spread to organs far apart from each other. Chemotherapy has particular uses after surgery that can increase the survival rate for patients with some stages of colorectal cancer. Chemotherapy can also help relieve symptoms of advanced cancer. Here are some take-home points from this session. Colorectal cancer is cancer of the colon and rectum. Colorectal cancer is the 3rd most common cancer among men and women and is the 2nd leading cause of cancer-related death in the United States. Colorectal cancer is believed to develop gradually from polyps. Polyps are precancerous growths that form on the inner walls of the colon and rectum. The exact causes of colorectal cancer are not known. However, colorectal cancer is not a death sentence and can be prevented and treated. Early detection of colorectal cancer can be done through screening. Economic and cultural barriers sometimes play a role in the lower rates of screening among African Americans. Thank you.